Good evening, everyone. Welcome, and thank you for joining us. I'm Namu, I'm the membership manager. We're joined today by Melissa Lee, who is our public governor and also our host for this evening. Thank you. Melissa, over to you.
Good evening, everyone. It's so good to see all of you at 6:30. All of you are very punctual. Thank you so much for joining us, especially the first time you're joining us. I would like to send my warm welcome to all of you. Do you know that the CUH Cambridge University Hospital membership is free of charge for everyone, and we also got a lot of discounts as well. Our team will send out the link. If anyone would like to join our membership, you're more than welcome. As long as you're 16 years old, you can join either a patient public membership or even a staff membership if you're a member of staff. Tonight, we are very honored to have Dr. Anna, who are going to share some children's health issues with us. Let me quickly introduce Dr. Anna. Because we got an hour, we would like to go through it very quickly. The first half an hour, Anna will be telling us about what she's trying to do to help a lot of children and families. In the second half hour, we will be welcoming all the questions from all of you. Dr. Anna Moore is Assistant Professor in Child Psychiatry and Medical Informatics in the Department of Psychiatry, University of Cambridge. Her goal is to develop personalized preventative clinical pathways for children's health, especially mental health. She's approaching this by bringing together data from a wide range of places, including information from medical, education, social care records, and genetics. Dr. Moore is using these to develop a wide range of novel digital tools to support personalized early identifications, interventions for childhood mental health conditions, with the aim of trying to tackle the long waiting time and difficult assessing child and adolescent mental health services. She leads the NIHR Bioresources. The short form is Decipher. Decipher means DNA Children's Young People's Health Resources, the first recordable community for children's volunteering to get involved in supporting childhood genetic research. Without further ado, let's warm welcome Dr. Moore.
Thank you so much, Melissa and Namu. Thank you so much. It's a real honour to be able to come and talk to everyone today. I've got some slides, so would it be all right if I shared the presentation and started? Oh, brilliant. Thank you.
Thank you.
Here we are. And I'm going to put it onto the right view. There, does that work for everybody? Is that working?
Yes, it's working.
Oh, wonderful. So I'm Anna Moore. So as Melissa kindly introduced me, I'm an assistant professor of child psychiatry and medical informatics at the University of Cambridge. I'm also the clinical lead for Decipher. So I work clinically here at CUH, where we provide psychological services for children who have been cared for at Addenbrooke's. And I just want to say thank you so much for the invitation to speak to everyone today about Decipher. So this is the NIHR's DNA Children and Young People's Health Resource. And it's a real pleasure to be able to talk to you about all the work that's gone into launching it. And really critically, I'm going to talk about how young people and their families have worked alongside us step by step of the way to shape it. So the project is groundbreaking in so many different ways. So firstly, its scope, it's open to all young people in the UK. Also how we're getting children involved via schools, and also for the first time, we've launched recruitment via social media. There is a really important emphasis on ensuring that we involve a representative community of young people. And finally, although perhaps most importantly, it's the way that we're building a participatory programme that is central to our approach. So Decipher is the first ever large-scale programme which facilitates children's participation in genetics research. And because of all of these firsts, a huge amount of work needs to be done to figure out exactly how we go about doing this. Working with young people and families has actually been critical to the success that we've had. And you know what, we really are delighted because the feedback on the programme since we launched nationally in July this year has been almost universally positive, and people are signing up to join at an absolutely fantastic pace. So we've got over 5,000 young people already involved, and we only launched as I say, July this year. So I'm going to firstly explain a little bit about what Decipher is, what it aims to do, and then I'm going to talk a little bit about how young people, parents and families have been critical to helping us to shape this programme. So Decipher, it's a genetics health research programme. It's led by the National Institute of Health and Care Research, Bioresource, and it's open to every single child in the UK. And one of our key aims is to be truly inclusive. So recruitment is open online to all 14 million children in the UK, and that means that any family can join. So it's going to investigate a really wide range of conditions, for everything from like mental health to cardiovascular disease, diabetes, and it's going to give us the opportunity to tackle some of the really greatest health challenges that are facing us all by getting young people and children involved in pioneering cutting edge research, not that's just happening at Cambridge, but that's happening across the UK. So we know that around 30% of people at any one time are living with a long-term condition. And that includes disorders like diabetes, health disease, mental health problems. And almost all of these diseases, which includes those examples I've just mentioned, but actually also nearly all other disease anyone can think of, have their origins in the first 20 years of life. And studying our DNA is crucial to understanding how they start, but also why some people get sick and others don't, as well as who are going to benefit from which treatment at what time and when we should be giving it. So to help us with this, we're inviting families to participate in the programme. But we also know that advocates for the programme are just as important, as well as young people and the parents who are really helping us to shape this programme. So firstly, I just want to talk a bit about why is a programme like this so urgent and so important. Well, we know that over 1.7 million children are chronically ill, and this is in the UK, and that is a statistic which is actually quite an old stat from NICE now, and actually the number really sadly is growing. But we also know that there's some really challenging predictions for the future of healthcare that really we all need to be aware of. So there's been a Health Foundation report that was published recently, and that said that 9 million, or just over 9 million people in England are projected to be living with a major illness by the time we get to 2040. So on top of this, we know that there isn't enough health research relating to children and young people. So, for example, we've got major challenges with children's health regarding to nutrition, also mental health and well-being. So we know how much CAMHS is struggling, and that just names a few. So there's endless examples we could pick up on. So to address these issues, we really need to urgently carry out research that helps us to understand these illnesses, to develop treatments for them, and those in turn can be used by the NHS to help the people it's there to serve. So we've worked really hard at trying to start to fix this problem with Decipher. So it's really easy to join Children's Health Research Programme. Joining is super easy. It's mainly online, although you can also do it by post if you want to. And soon we're going to be in clinics across the country as well. So there'll be lots of different ways that you can access the programme and hear about it. Firstly, parents or guardians consent. That means they give permission for the young person or the person they're responsible for, the young people they're responsible to join. And then young people assent, which means they agree that it's something that they want to participate in. Then once we've got that paperwork done, it's just a case of spitting into a tube and filling out questionnaires. But I'm going to say enough from me, because I thought we'd hear directly from some of the young people and the ambassadors who are much more eloquent in telling us how it all works. So we can see if we can get this to work.
Oh, the sound's not coming through, Anna.
So sorry, let me start again. There we go.
Yeah, perfect.
Decipher stands for DNA Children Young People's Health Resource. Decipher for the first time is saying we need to be looking at what happens in childhood. And so we're now reaching out to children and young people to provide their samples.
It's important to join this project by collecting more DNA and finding out what is hiding inside of it and improving people's lives. The more people that take part, the more DNA there'll be, so the data would be so much more accurate. So you need people from all communities to take part.
All you do is fill out a simple questionnaire online. You get a test kit in the post, spit in a test tube, seal it up, send it back to the lab, and then you've helped contribute to a very important project, which is going to help immensely.
It is so easy to spit in a tube, but it can be life-changing for someone else. I have mental health problems with my family. I know what effect they can have on the individual and the family around them. So if we can help prevent it in any way, it would be really great.
I think it's a very important project in order to make breakthroughs in mental health, rare illnesses and diabetes, all three of which have affected my family immensely.
Children have a superpower to do what they can with their DNA, and scientists can see and understand how disease happens.
I live with a connective tissue disorder and a chronic pain condition. When I learned about the Decipher project and the potential impacts that it could have on helping us find answers for these conditions we just don't know enough about, that really resonated with me.
Decipher's special because it's focused on children and diversity, and it will help their research and will impact future generations.
I would encourage them to get involved because a tiny sample can go a really long way and help loads of people in the future. It's so easy, all you got to do is spit in the tube.
Hang on. There we go. Get my slides right. Thank you. Anyway, so in order to achieve this, working alongside families and young people has been absolutely critical. We've wanted to do it from the start of the project. The opportunity to do good and the fact that the project will allow perhaps one of the most significant shifts in how we understand and do medicine is really unquestionable. But there are also a huge number of really important issues that we absolutely needed to get right from the very, very start. And the only way to do this was to work closely with families and spend time talking and listening to them. We also knew that we needed to do it in partnership with charities and organisations who really understand some of the key issues at hand. And so we partnered with Anna Freud, which is one of the leading mental health charities in the UK, but also Birmingham Women and Children's Hospital, and also the local hospitals here. So we did a lot of work also with Generation R, and that's the NIHR's group of young people who help to improve research studies. So some of the areas that we really wanted to understand were, for example, what should we call ourselves? Do we want to have a new name? Do we want to be the young people's bioresource? What kind of age group should we be involving? Should it be all children, or should we focus on a particular age group? How should we be communicating about the project and approaching people to invite them to join Decipher? And then can we do this on social media at all? Is that appropriate? Is it acceptable? Are there other organisations that we should be working with? So a really critical aspect of Decipher is that we aren't recruiting young people into a particular study. Rather, we're inviting them to be part of a community of young people who are willing to participate in research studies broadly. So when they join, they agree to be contacted and invited to participate in future studies, which of course they can agree to do or decline as they prefer. So this is really, really valuable for research, because one of the biggest challenges to carrying out these kind of research studies is identifying people who want to be involved in the first place in a study. And this is even harder when it's about children. So one of the ways to make it easier is when it's about treatments for specific diseases, because you've got a group of people who are in contact with health services who are easier to contact and often very passionate about helping improve the particular disease that they're experiencing. But when we're doing studies which are doing other radical work, so for example, prevention of illness or focusing on early identification, early intervention, or understanding the early phase of diseases, or how normal development takes place, or even how our genes and environment interact. In those cases, we need to involve young people who don't have any serious diseases. So we had to address this. We had to be really creative in how we thought about approaching it. And it also brought up loads of ethical issues, and we had to do a lot of thinking with families and young people about the best approaches to take. So, for example, it was just some of the questions were, how often can we reasonably ask a young person to get involved in studies? what's the level of background information we need to ask about, and is it okay to ask to link to their health, education and social care records. So these are just some of the very important things we had to work through. So during the first 2 years, we spent loads of time piloting different approaches and really listening to families and young people about what worked and what didn't. And I'm going to go through a very high level overview of some of the things we heard and what we're doing about them. So firstly, it sounds really trivial, but we needed to really understand how we should present ourselves and what our name should be. So originally we were called the NIHR Children and Young People's Bioresource. And while this was accurate, one might say it's not particularly accessible to anyone really. So not even us, we found it hard. So no one really knew what it meant. When we spoke to the public about it, they found it was really hard to remember. No one really knew what a bioresource was nor what NIHR meant. So, and it was just really, really long to write everywhere. So in response to this, we commissioned some professional help. We worked with children and young people from a really broad range of schools, did lots of surveys, and we ended up with the name Decipher. So it's an acronym, so DNA, Children and Young People's Health Resource, which kind of describes what we're doing, but it also indicated how we were deciphering some of the biggest questions relating to health for this generation. So young people and families were really excited about the name, so that's why we went ahead with it. So the other thing we wanted to know is what ages should we involve children? So in our early thinking, so we've been going for about 4 years now, when we first started the thinking behind the project, and some of our earliest pilots actually aimed at older children between 11 and 15, because as a project team we felt that the concepts were really hard to understand. Informed consent, so parents giving permission and assent, so young people agreeing to be involved, is absolutely critical. However, over time, as we spoke to families, we really heard that parents of younger people and children really wanted to support their children to be involved. So with their support and with their permission, we asked the ethics committee if we could extend it to a broader age range, and everyone agreed that this was absolutely the right thing to do. So now we're open to all children from birth to 15 years. The other thing we really wanted to understand is grapple with the issues of joining entirely via digital pathways, and if doing it via social media was acceptable. So it was a completely new approach for the bioresource, and in fact into any research study involving children. And so we had some really big questions about how to communicate via social media. We really wanted to involve young people who didn't have serious health conditions, as I described, as well as those who did. And so the usual routes of doing it via hospital clinic wasn't as useful. So we initially decided to go via more traditional routes of via schools, and actually our first pilot was just recruitment via schools, but this took pace as COVID hit, and so we were literally launching at the same time as all the schools were shutting down, and then all the homeschooling happened, and as you can imagine, it was the last thing on people's minds, but also we found it to be incredibly difficult. And so one side effect of the pandemic is that it really moved forward the thinking very rapidly about how we all use digital for all sorts of things that we hadn't previously considered to be a good way of doing things. So as we were talking more and more to families, it became clear that actually they saw it as a real benefit because they didn't really have to go somewhere, and also we found that the reach was much greater. So as we were talking to people, one of the important aspects of this kind of research is that the more people we're able to involve, the better quality the science we do is. So there's this real moral driver for taking that approach, because we had the much greater reach and we could reach more people to get them involved. So, but in response, we had this huge piece of work to create the technology to allow us to do this, which again we were doing with support of young people to help us get that right. But we finally launched in July this year, and it's been a huge success. So as we said previously, we've got well over 5,000, I think it's actually approaching 6,000 young people now who have joined, and that's been in about 3.5 months. And we're seeing it steadily growing. So it's really exciting that it's worked well. So underpinning all of that, and especially taking the digital approach, is this need to be really clear about what we're doing and why. And because of our approach of recruitment via digital and online predominantly, although also people can do it by post, we're really reliant on the written word. And also there was a lot of pressure to get quite complicated messages distilled into snippets that work well on social media or on other communications. So at times we heard that we weren't doing this particularly well, as we might do. And so we've been working with a professional communications partner who've got expertise in developing social movements and thinking about how we can communicate that really effectively to a broad range of groups of people on social media. So the final bit was that we had feedback that what we were developing didn't really appeal to people from a broad range of backgrounds. So in response to that, we've developed new partnerships with Egality Health predominantly, but also Anna Freud, to help us to really shape this. And that's very excitingly one of our emphasis for the coming years. So one of the critical things was that families raised was that we really need to make sure that we presented the programme right. So the context that we were working in is that there'd been some really high profile projects which had recently been running as we were setting this up that had really unfortunately got this wrong, and that had some really catastrophic effects for their project, to the extent they actually had to be halted and abandoned. But the other really serious impact was that it created real problems with trust around using DNA for some of the kinds of studies, and some kinds of populations. And given we were proposing to launch this program at really huge scale nationally and also with children, we really had to make sure that what we're doing is acceptable and how we're communicating, and also that we're transparent and understandable, but also that a lot of really complex concepts were described clearly and accessibly. So it's really critical when people join that they're doing so completely understanding all of the different aspects of what they're signing up to. So how the data is used, what it's used for, by whom, how we keep it safe, what the security issues are. And so we needed to make sure that we did this in a way that young people could grasp too. And that was quite a big ask, especially as we were extending the age range to younger than 11. So involvement from participants and the public has actually been, really critical right from the start to get some of these things right. So we really strongly believe that we can only work if we're really made for and with children and young people and their families. So their voices are absolutely really do matter to us, and we have listened, we've had to listen, we've wanted to listen every step of the way. They've really helped us shape our recruitment approach, everything from the forms, who our comms partners are, how we're communicating, what our posters look like, what we're saying. And as we grow, we're also going to be speaking to them a lot about the research that we support and the projects that we want to enable. One of the managers of our participation programs explained at one point why it was so exciting for children and young people to be involved in this, and it really hit home for me actually when she said this. And she said it's one of the very few situations where young people can stand shoulder to shoulder with adults in their contribution, and that's in relation to something that affects not only them but is relevant for the whole population. And we're really proud of that. So the young people who join are making a hugely important contribution to the next few hundred years of science, and really that's incredible. It's been repeatedly said that the movement that we're creating here is going to really create a most significant step change in our understanding and our ability to develop new treatments for young people, but also across the whole lifespan. So now we're live. Our young ambassadors are also involved in advocacy where they want to be. So you can see here some great examples of young people who have and their families who are talking about why it's important to them. And really, we can't thank them enough for making their voices heard. So loads of our young people have got really important reasons for being involved. Some are interested in their future careers in health research, for example, or being or clinical roles. And others, as you heard in the film, have got family histories with health conditions, and it's really important to them that they're able to contribute to that in a way that they feel is really meaningful. So a health research programme that no one hears about and that can't help solve really big health challenges isn't really very helpful to anyone. So we've been using social media in this early phase of our programme to really reach out to and communicate with the nation. And we've been doing that not only with our young people ambassadors, but also with medics and influencers and partners who are trusted, who spread the word. So one example is Zaan van Teleken. So he's one of the doctors in Operation Ouch, who's been absolutely fantastic in supporting us. Like, we can't be more grateful. And then also people like, so for example, Nina Wadier, again, hugely passionate, Giles Yeo, Rachel Ward, so she was a GP that was on television every morning with COVID. So we're just incredible during the COVID pandemic. So we're just incredibly grateful for all the support we've had for our ambassadors. It's made such a big difference. And in the next phases, we're going to be working with schools. So young people are going to be able to learn about health research, and families can have the chance to hear about it directly via their schools and as part of their curriculum. And we're going to be also working with clinics and hospitals next year, where we will be working with particular diseases and patients who are suffering from particular problems. So we're hoping that you're going to start to see more and more about the programme. So as a final item, I'd want to also talk a little bit, or show you what the other end of participation in research can look like. So in the autumn of 22, we really needed to test our recruitment materials online, and also test the digital. So I'm talking about that important digital process, but we needed to test it like in a small population of people before we went national and found out that the whole system crashed. So we needed to get, and we also need to get lots of feedback on our posters and how we're communicating, but with a broader range of people. So we held a regional preview or launch at St Michael's School, which is just in the outskirts of Birmingham, and we asked students and staff there to help us devise a really exciting event, which they designed themselves. So they created all the content for it, which included learning activities about health research and how we could get feedback, and how we can communicate it, and also teach it in schools when we do the schools launch. And a really important part of this was also understanding the needs of a diverse range of participants, which is why St Michael's, which is in Birmingham, was absolutely perfect. So we know that Birmingham has got the greatest diversity of all the cities in the country, and also the youngest population. So everyone had loads and loads of really fantastic ideas. It was a million times more exciting and fun than anything we'd have come up with ourselves. And then there's this video that was created, which kind of gave a highlight of it, which I want to show you, just to give you an example of just the amazing creativity of all the young people who helped us design the event.
Good evening, it's time for Decipher Live. Please welcome your host, Ayo Akinwolere.
How are we doing? Well, this is the first time ever the Decipher project has actually been unveiled to the world, so this is a really special moment. This is an exclusive. It's also about how you can do your bit to help researchers discover more about how DNA affects all our lives. What is Decipher, Anna?
Oh, well, it involves thousands of people, and it's all about genes and our DNA. So we know that there's a link between genetics and our DNA and the likelihood of us getting lots of diseases, so cancer, cardiovascular disease. We're also increasingly finding actually there's a link between our genetics and our mental health.
Fantastic to see so many people here tonight, very good mix of loads of young people, different ages, the parents, staff.
The key to Decipher is just having information from as many people as possible, and it's really critical that that's diverse as well.
So we're asking schools to get involved with the Decipher project because we really want to understand more about how to support children and young people with mental health.
It's the future health, obviously, of the children and of their children, and just to make sure if there can be any advances in care for their children and future generations. For me, that's why I'm here. Honestly, it was amazing. We haven't had an event like this at school, ever. So yeah, it's been great.
I think their contribution is essential, so I thank them for their time and hopefully for their contribution in research in the future as well.
Oh, it's brilliant.
Good evening, it's time for Decipher.
I need to get better at this, hang on. Next slide. Oh, here we go. There we go. Sorry about that. So what's next? Well, the main priority going forward is to really figure out how we can ensure that the community volunteers that we're growing is representative of the UK population. And this is perhaps one of the most crucial parts of the project. Because of the way that DNA is structured, research done on DNA from people with just white heritage can be really hard to apply to people who have got different backgrounds. if we do research into new treatments or to understand the causes of disease, which just using DNA that's from people with the white heritage, it means that there's a really, really high risk that these treatments won't be as helpful or even helpful at all to people from other backgrounds. And given there's so much potential to make a step change and improvement in healthcare, it's also critical that these benefits are available to all. And so to make sure of this, we're embarking on a really large programme of work to understand and tailor the programme so that we can reach and appeal to and engage people from all kinds of backgrounds. So we're partnering with a range of charities and also an organisation called Egality Health who are going to help us. And this work will predominantly involve working alongside a range of communities to really hear how we can explain and communicate the project to them in the best way. And a key part of this is going to be the work we're going to do alongside schools. So we're working very closely with a multi-academy trust called United Learning, which is incredibly committed to supporting us in this. They've got over 100 schools across the country, really broad ranging, and it's going to be great to be able to work alongside them to figure out some of these really, really big and important questions. So our schools campaign launched just this week. So it's really exciting. So we've gone live in about 50 schools from across the country so far. And we're going to be, the approach we take is to discuss how young people can talk about it, how they can learn about it, and how they can join in. And all of these three ways can really help with the health issues that matter to the young person. And we really emphasise how their voice matters and how we as academics or researchers, we really want to hear what they've got to say and their views. We're really clear that at all ages, you can really actively help research by participating. And this is really the reason why we speak so often about heroes in our communications. And that's because we really believe it. The young people who are participating in Decipher genuinely are heroes for health. And without their participation, then health research just absolutely cannot take place. So I just want to finish up by highlighting, as well as all of the young people and the families who have supported us so far, all the fantastic people in the team who are working so hard behind the scenes to be able to make this project a reality. So without their dedication and their hard work, and they often go way beyond what's expected, we wouldn't be here today. So I can't finish this talk without saying thank you to them as well. So thanks so much for listening today. It's been a real honour to be able to talk about Decipher and how young people and families have really shaped and designed what we've done. And if there's any questions, I'm really, really happy to take them now. So please do get in touch if you'd like to hear any more. Thank you.
That's wonderful, Dr. Anna. And any questions from the audience? We got lots of audience today. I have to sum up that the presentation Dr. Moore has shared is really, truly amazing. And it's also very impactful. I wish other countries will have Decipher as well, that we are listening to children and young people, which is truly amazing. Now, let me throw the ball to the audience. Do you have any questions? Please put them onto the chat on top of your screen, and we will try to pick up some questions. We only have half an hour today, but we'll try to answer as many as possible. If any questions that we haven't been able to answer tonight because of the time limit, we will try to collect all of them and then send it to Dr. Moore and hopefully come back to you by next week or the week after next, as soon as possible. Dr. Moore, while we are waiting for the question, may I ask you, have you thought about doing the same thing in other countries? For example, in Europe, trying to collect some more DNAs and also the children's voice?
Yeah, I mean, gosh, it would be amazing to be able to take an approach which is just limited to England. I think at the moment it's been I mean, we're just really excited about the opportunity to do the project in England, and also just there's so much potential just to make it work so well here in the UK that I think that's our first priority. But I mean, we wouldn't close the door to the idea of doing it more broadly in the future. But at the moment, absolutely, it's a UK project. And I think the other thing also is that that we would also like to say that, you know, where one country leads, then hopefully others will follow, and we'd obviously be really keen to to share our approach with anybody who wanted to do it as well. So yeah, no problem.
When I heard that you work with United Learning, which has more than 100 schools in the UK, that is fantastic.
Yeah, they have 66,000 pupils. So we're really excited to be able to, as we launch, we've got another way to really, communicate the project to the schools. But I think the other thing that I'm really excited about with the schools work is that while when we're doing it through online, we've got this really broad reach and we can reach, potentially millions of people, which is exciting. With the schools work, because we've developed this whole suite of materials and educational materials and opportunities for the children, it feels like we kind of have almost a two-way relationship. So we can really kind of contribute to education and learning and give and kind of provide the young people with opportunities to learn more about the importance of health and health research and how genomics can contribute to that. So that's why I'm particularly excited about that program of work here.
Really amazing. We got a number of questions from the audience. The first one is Neil mentioned that it's a great project that Dr. Anna and the team is doing, and thanks for explaining Decipher very clearly. Neil's son has type 1 diabetes. Will the DNA resources help to identify this and also help the other children or even her daughter as well?
Yeah.
So a little bit.
Yeah, absolutely. So one of the a really important driver for this program is around early identification of illness, whether that's diabetes, mental health, any disorder. So the project will help us to develop new ways of identifying problems early, so including diabetes, absolutely, and also excitingly, so I find it quite interesting, but subtypes of diabetes, because at the moment we just see it as type 1 diabetes and type 2 diabetes, and there are a few rare variants, but actually in reality we're going to be increasingly finding out that there's different subtypes, and depending on your subtype and probably your genetic profile, you're likely to be more helped by different type of medications. The only thing that we won't be able to do is that this project doesn't give any individual feedback to people who participate. And the reason for that is that in order to make sure that everyone's data is safe and secure, it's all de-identified. So as soon as we get the sample, the person's individual data is separated from the sample, and we store the samples for security reasons, and then we do the research using that sample. And so there's no information or no way we can link the information, the research that we do, which is on populations of people, back to individuals who contribute. However, in the future, the research that we do will benefit individuals by enabling us to apply it. So when we apply that research within the health system, it will absolutely help us to identify people who've got, whether it's diabetes or other diseases. So yeah, diagnosis is a really big part of it. And then it says, can the research lead to approach? Yes, it potentially could. That's what our hope is. So our expectation is that genetics is going to be increasingly identified as one of the key ways in which we can develop new treatments for people. So that's around targeted drugs. So for example, we're already finding, so type 1 diabetes is a really great example. So there's already finding that there's a subtype of diabetes, type 1 diabetes. And if you have a particular genetic profile, it means actually there's a tablet you can take instead of having to take your daily injections. And so we're already finding that we're able to better treat type 1 diabetes as a result of this kind of research. So it's really exciting. So people who have families who've got people with type 1 diabetes will know how difficult it is to have to do the tests every day and then take the insulin injections every day, especially for children. And if we can actually now treat that with tablets instead, it's really revolutionary. Yeah.
I've also got a question about security. How do we store your data, and possibly related to data protection and GDPR? If you could explain a little bit, that would be fantastic.
Yeah, absolutely. So the data is all stored at the same level of security that NHS data is stored. So that's the first thing to say. So it's absolutely the highest levels of security that's possible. On top of that, we do, I described previously, we depersonalize it. So what we do is we separate out the information relating to the individual from the sample. So when it comes to the lab, we separate those two things out, and the sample has on it a barcode. And from the minute that they're separated, that sample is only ever dealt with as a sample with a barcode on it, and it's not possible to link it back to the individual. So we've got this two-phase approach. One is top-level informatics security, which is the level of the NHS data, and the second is we completely separate it out. So there's no way that we can make that link back. So I hope that answers the question well.
Thank you. Irene got a question about how are you planning to support children if you found any kind of predisposition?
So at the moment, so this project is purely research, so it's not got a clinical component to it. So when a young person contributes their DNA and to Decipher, we don't carry out tests on that to identify if that person's got any disorders or not. So that's the first thing. And also a big part of it is that actually we don't provide feedback to individuals. So the purpose of it is it's a donation to health research. And what we do is we pool that data into groups, and we do research on cohorts of people. So lots of people have got type 1 diabetes, or lots of people have got mental health problems, and we look at patterns in those groups rather than look at things relating to individuals. So we don't feed any information back to young people. That said, the research will enable us to identify young people with problems early, and part of the health research that the Decipher enables will stimulate work that helps us think really carefully about how will we manage young people who are identified with disorders earlier, and what support do we need to put into place for families, what are the treatments that can be used to for children who have got those disorders. And that's the next phase of research that this program will really stimulate. So it will create that benefit, but the people who contribute their sample won't have any disorders identified for them, and we won't be feeding back to them specifically.
Irene's question is, there could be lots of sensitive topics when we connect that with Heather's questions, when two questions connected. So you're going to save all their opinions, all their information in a very secure way, right?
Absolutely, yeah, absolutely, yeah. NHS level security system, so it's no different from all the data that's stored about people in the NHS. Exactly the same level of security is used for this. So it's as high as it can be. Yeah.
Fantastic. And Gloria come up with a question. Am I correct to assume that children with cancer are not eligible for these projects?
No, it's open to everybody. So whatever a young person's diagnosis is, whether they have a disorder, so whether that be cancer, I mean, we keep saying diabetes is an example just because it's something lots of people here heard about, but rare disease, any disease that anybody has, they're really welcome to join. And then also for young people who have got no disorder as well, they're welcome to join. So we're open to every single young person from birth to 15 years of age in the whole country. So please join if you'd like to.
Do they need to be British citizen?
No.
Okay.
No.
Very good. Any other questions? Maybe we will wait for a few more minutes. If not, I will ask Anna to have a conclusion sharing with all of us. And then at the end, we will have a very, very short survey that will come out on the chat box. If you could just quickly answer some of the survey, that would be fantastic. And it literally takes less than 1 minute, as far as I know, very quickly, so that we can collect some of your feedbacks for this evening. That will be wonderful. And also the recording of this workshop, this webinar will be posted on our CUH website very soon. And you can also find it on YouTube as well. If you want to share with any of your friends or families, you're more than welcome. Oh, we come up with another question from Neil. Do you plan to extend to other countries?
At the moment, we have no plans to extend to other countries. So, I mean, other than Scotland, Wales, and Ireland. So it's a UK-wide project. It's not limited to England. But no, at the moment, we don't have plans to extend. Yeah, but
we're so lucky to have this project in the UK.
Share our approach with any other countries who wanted to learn and who wanted to do it. Yeah.
I think once we do it really well, I'm sure other countries will copy it quite quickly because it's doing something really good for children and young people. Oh, we come up with another question from Julia. Ensuring the trial participants have the right information about what data will be used. Is it always a challenge? How do you get these across when children in the most appropriate ways?
No, that's a really important question.
Yeah, it is.
Thank you. It's a really important question. We did a lot of thinking about this. So we've through consultation with all of our young people and the families that we worked with, we identified different age categories that we needed to tailor our information to. And as a result of that, we've on the website, so if you go to the website, you can access information which is age appropriate. And then we did lots and lots of work with young people and children and families to make sure that what we were explaining was in a way that they could understand, that it was accessible, it wasn't too long and boring. We took out all the medical jargon. And I think also we've got some videos. So we wanted to, and that's actually the next phase. We're going to be doing a lot more of that. So at the moment, most of it's is in written word. And I think we've got some videos which can explain it. And I think on the website, if you go to the website, there's some videos that explain it. We've then spent time, as I say, with young people and families to really distill that, and actually teachers as well. So we've got some teachers involved. Lucy's just put a link into the website there so you can see examples of the information and how we've done it. Thank you, Lucy. And so it's just been really about kind of making sure that it's just, short sentences, lots of imagery, and testing it out with lots of other people and lots of people to make sure that it's accessible. Next phase, so from the launch, is we're going to be doing a lot of work to think about how we can make sure it's accessible to people with lots of from lots of different groups. So we're going to be doing lots around making it accessible to people with different languages as their first language, also for people who have got other disabilities who might need the information in different ways. So yeah, we did a lot of, that's a big emphasis for next year as well.
Great. Gloria said that, thank you. Are you aware that the whole gene sequencing using DNA for all the cancer patients under 25 is available on NHS?
Yeah, absolutely. So there's a clinical genomics is, really rapidly expanding as a specialty. So it's as a result of actually, some of the research, a bit like the research we're facilitating. Now the impact that DNA and genetics has on our ability to identify and target treatments to individuals and to treat early is so unequivocal that in some disorders, and cancer is absolutely leading the way in this, means that actually clinical genetic screening is now standard in some disorders. So, for example, childhood cancer, which is absolutely fantastic. We now need to do that work for all other diseases, so that's not just cancer that they're standard for, but actually it's standard for other disorders as well. But before we could justify that, or there'd be any reason to do that, we absolutely need to demonstrate that we can use this data to diagnose early, to identify illness, to be able to create treatments that make a difference. And that's what Decipher is going to enable us to do for the rest of all other diseases what's been done for cancer. And actually, and although it's not, I say it's been done, it started for cancer and they're ahead of the game, but there's still a huge amount of work still to be done with cancer, which is why, as I said earlier, we are open to cancer patients as well if they wanted to join. That's not a problem at all, because there's a huge amount to be done for that field as well. So yeah, no, it's a brilliant point. Thank you, Gloria. Thank you.
It seems to me we're doing extremely well. We answer all the questions. Anna, would you like to have anything you would like to say? You would like to share with us?
No, I think no.
Audience.
Yeah, I just want to say thank you so much for the opportunity to speak. And although, you know, Decipher's got fantastic ambitions, but just really reiterate that none of it was possible if we hadn't have been able to do it alongside, you know, the families and young people, because there's so many really kind of gritty issues. And also the thing for me personally, as I've gone through this journey, it's been really eye-opening to see how I thought, or we as a team thought, would be the right way to do things, and actually how we've really changed our approach based on listening to young people and their families. And actually, often they were right. They're more often not right, and so we're so grateful to have done that. And it's just made such a big difference to where we are today. So no, it's been great. So thank you. Thank you.
Thank you so much, Dr. Moore. And I would like to say, but thank you so much. It's really amazing that Decipher has developed, and we listen to a lot of children and young people's voice. And tonight's seminar, without possible, won't be so successful without Namun and Lucy working at the back with a lot of administration work, and also Dr. Moore's wonderful sharing. Thank you so much, everyone. For joining this evening. I just want to let you know that there'll be a very short survey. Namun, can you put it out? If you don't mind, just quickly answer them. It takes less than 60 seconds, very quick, so that we can collect some of your feedback. And I would also like to encourage everyone, if you haven't joined CUH membership, please, because obviously you spend an hour with us today. I can tell that you are very passionate about children's and young people's health and also our NHS health system. So joining the membership would be a good way to support the CUH. Also, I didn't notice that. I only found out today that we have a lot of discounts. Like if you go to shop at Waitrose, MMS, Sainsbury, you will get cash back by joining the membership. If you're booking your Christmas holiday, there might be cash back to you as well, or some discounts. So please share with your friends and family. And tonight, I would like to say thank you to all the audience and also Dr. Anna and the team who are helping to make it happen. Thank you so much and hope to see you next time. Bye-bye.
Thank you. Bye-bye. Bye.